Shami's actually a nationally ranked BMX person, so not just a hobby. So Mahesh Krishnan, I'm a nephrologist. My story is a bit similar and a bit different in that I went into healthcare really to change the world, right? That was sort of the prototypical thing when you write your medical school essay, but I really wanted to do that. I'm a very systems-oriented person. So when I see systems, I see the problems, I see the way they work, I see the way they could be fixed. And while that could be a good thing, when I first went into private practice, that was a bad thing. In that the healthcare system that I encountered when I first left my fellowship in nephrology and went into practice in Northern Virginia was horribly broken. And so I tried Herculean things to improve the care of my patients. I would round after hours, I would do all sorts of crazy things to sort of compensate for a system that was terminally broken. And at the end of that, I pretty much burnt out. But I couldn't provide the level of care that I wanted to provide for my patients despite my efforts. And it was costing me things on the family side, on the personal side. And so I kind of burnt out. I was fortuitous in a way that I had done a lot of work with pharmaceutical companies at that time before. I had written my first book, which was a book meant to allow pharmaceutical representatives to detail academic medical centers. And I had done a lot of sales training for multiple different healthcare companies at the time. And so as I was burning out, one of those folks that I worked with said, hey, did you know Amgen was looking for a medical director for Epogen at the time? And so I took that job. I made the transition from after 5 years of clinical practice to go into industry. Led a bunch of things at Amgen for 5 years. This is actually a theme with me. I switch careers every 5 years. So the second 5-year theme at Amgen was coming to its end. And I got a position with DaVita, which, as many of you might know, is one of the largest kidney care companies in the world. I started off in research. I ended up running their international medical affairs organization for 5 years, building clinics in 240 clinics in 13 countries. And then for the last 5 years, have really been running the venture group and the external innovation group at DaVita, while at the same time doing a lot of public policy here in Washington, D.C. I'm the current chair of Kidney Care Partners in D.C. And at the end of the day, I have developed an affinity to train clinical leaders. And I say clinical leaders, not just physician leaders. I do a lot of mentoring, both within the organization and outside of the organization, for physicians, nurses, dietitians, social workers, folks that are subject matter experts on the clinical side that need to be more interoperable with their organizations. And so as we sort of did this, had that conversation, Shami and I, we found that we were both very interested in